It'll be easy for you, Dr. Owen, when you speak. You just have to move over here. Okay, I'd like to introduce Dr. Austin Owen to you tonight. He comes to us from Marysville, or I'm not sure how you say it in Tennessee, but Maryville? Okay. Not only am I not from Tennessee, I'm originally not from the US, so I'm really having trouble. So Dr. Owen is a Loma Linda University graduate from dental school, but he is a Tennessee native who loves people and loves dentistry. His goal is to provide uncompromising, excellent, and comfortable dental care for each patient. He has received multiple awards for his clinical skills, which he continues to enhance through advanced education courses in dentistry that he takes and teaches. During his schooling, while on a dental mission trip to Bangladesh, he discovered that dentistry combined with service brought him great joy. Outside of working, you'll find him biking, hiking, camping, gardening, playing violin or viola, cooking, and telling dad jokes with his wife and children. So thank you so much, Dr. Owen, for coming to present tonight. We appreciate it.
Hey. I have a little bit of a tickle in my throat, so I'll try to keep my throat clears to a minimum, but no promises. See, already started. So, it's nice to see all of you this Tuesday evening. This is a very special church to me because this is where I got married 13 years ago. And that was actually probably the last time I was on the stage. So it looks a little different now. And it's a little bit different feelings. There were still nerves, but I have to admit that was a little bit more nerve-wracking. Anyway, so it's nice to meet all of you. I will get to it. Just real quick, my apologies. I tend to talk fast and kind of loud. So I will try to slow it down, but no promises. So if you wouldn't mind with me, we're in a church, and I'm a big believer in God, and I'd like to pray with you all just to ask Him to be with us as we talk about health and, yeah. Dear Father in heaven, thank you so much for this opportunity that we have together tonight to discuss health and discuss the bodies that you've blessed us with. And as we live in a world of sin, there are many opportunities for sin to affect our body and our health, and you still give us the knowledge and the keys to treat those things. So I pray, Lord, that what we discuss tonight can be a benefit to everyone's health here, but mostly, Lord, we pray that you are glorified. Come quickly, Jesus, in your name we pray, amen. All right. So, beyond the toothbrush, connecting your teeth to long-term wellness. That is me. That was actually, it's kind of hard to see. We were at the Bonneville Salt Flats, and this was when we were moving out to Loma Linda for dental school, and we made a nice long journey of it. Instead of going straight from Greenville, which is actually where we left from, straight to Loma Linda, we went up north, went to Chicago, made it to the Badlands in South Dakota, and went up to Glacier National Park, and then drove down, got to the Bonneville Salt Flats, where I was attacked by a toothbrush. I'm actually really grateful for the clarity of this picture, because that toothbrush is actually pretty gross. It was thrown away right after that picture. Anyway, so Rhoda gave me a little bit of introduction. This is my family. We've got 3 kids, 9, 6, and 3, 2 girls and a boy. I love God and my family. I'm a general dentist in Maryville, Tennessee. If you're really southern, it's Marville, Tennessee. Graduated from Loma Linda University in 2018. I have practiced in California, where I practiced in a private practice and public health for a few years. That was an interesting experience. Grateful for it immensely, and I think public health is a huge, great service that's very important. Enjoyed it so much. I enjoy hiking, biking, gardening, boating, cooking, making music, all those things. So just a couple pictures of some really core and good memories. And my wife right there, Cassia Owen, formerly Cassia Gallimore. She, just quick side note on that, she's not here so I can embarrass her without fear. But after we got married, her initials went from CEG to CEO. And she likes to remind me of that, not infrequently. So, anyway. All right. The oral microbiome, the gateway to systemic health. The mouth is the front door to the mouth. Wait, yes, the mouth is the front door to the body. Everything to get into the mouth basically goes, goodness gracious, this is going well. Everything to get into the body goes through the mouth. The mouth is not an isolated ecosystem. In 2000, prior to 2000, it was largely thought the mouth was separate from the rest of the body. There was dentistry, and then there was medicine. And then in 2000, there was more of a merging of the two, and it's become much more commonplace, where they realized that the mouth is the gateway to the rest of the body. It's not an island. And whatever goes through the mouth tends to affect the rest of the body. Unfortunately, there's still a little bit of a divide between the two between dentistry and medicine. And that's just partially just how things are set up right now. And physicians are very busy dealing with other parts of the body, and the dentists are very busy dealing with the mouth. That it's hard to merge, but it becomes that much more critical for us to be able to work together. So, because the mouth is the beginning of the digestive tract. That's where food goes in, and digestion begins with chewing of the food, breaking it down to a more manageable size for the body to be able to digest efficiently and quickly. It lubricates the food so it can get in quickly, or get down to the digestive tract quickly, as well as where digestion begins with the enzyme called amylase. Amylase is in the saliva, and it starts to break down starches. And so back when I was in my undergrad, we were in our physiology class. We did an experiment where we would chew crackers for an extended period of time, just regular club crackers. And after a while, the crackers started to taste sweet because the saliva in your mouth has these enzymes which start breaking them down to their simple sugars. And so you start getting that sweet taste before it even gets digested. So, interesting fact there. The mouth is the beginning of the respiratory tract. You breathe in through your mouth, hopefully through your nose mainly, but we still breathe through our mouth, and that air goes straight to your lungs. And whatever else is in your mouth that you breathe over tends to go to your lungs too, which opens up a world of problems, but that's another conversation. And then the bloodstream. The mouth is a pretty hostile environment. From chewing, toothbrushing, and putting things in your mouth like fingernails and things, it's very easy to cut your gums. And the mucous membranes in your mouth are very thin, and they have direct access to the blood vessels, which go everywhere else. Also, underneath your tongue are the sublingual capillaries, and those are very thin, and it's very easy for certain things to get into them. For example, if someone's having chest pain, and they're given nitroglycerin, it goes underneath the tongue because it's absorbed super quick. So there's just one example of how the mouth gets you to the bloodstream quick. Also, periodontal pockets. Periodontal pockets, we'll talk about them more later. The periodontal pockets are the turtleneck around each tooth. I'm sure you've all had that done where you've had your periodontal probing done and they've said 3, 2, 3, 3, 2, 3. Now, when those get irritated, they bleed. I'm sure all of us have experienced some bleeding gums. Well, guess what? That is another entrance to the bloodstream, and that's another area where bacteria and fungus and viruses can enter into the whole circulatory system. The mouth is the systemic superhighway. It's home to millions of bacteria, viruses, fungi, and they live in a delicate balance, a symbiosis. And you swallow, this is also fun, swallow 1 to 1.5 liters of saliva a day. So, yeah, that's a delicious fact. So whatever's in your mouth is getting brought down to the rest of your body. And this has a downstream effect to your gut health. So symbiosis, which is where a healthy mouth supports symbiosis versus dysbiosis here. Symbiosis is when everything is balanced. The body loves balance. Everything works together very well. All the organs do, the kidneys, the liver, everything. And it all starts in the mouth. A healthy mouth, most of the time, means a healthy gut. And an unhealthy mouth, or an unbalanced microbiome, is an unhealthy body, typically. And that is dysbiosis. Now, a few things that are interesting is that as stuff gets into the stomach is very acidic, and it's very easy for things to get dissolved. However, there are a few bacteria that survive it. And these two bacteria right here, there's more. We've all had a stomach bug, so we all understand that. But these two bacteria right here, Fusobacterium nucleateum and Porphyromonas gingivalis, are oral bacteria. And they are not good oral bacteria, and they can survive the hostile environment of the digestive tract. So if you have a lot of that built up in your mouth and you swallow it, in that 1 to 1.5 liters of saliva a day, it survives the stomach and then it gets dispersed everywhere else. Fusobacterium nucleateum is one of the causes of colorectal cancer, IBS, and pregnancy abnormalities and miscarriages, all from your mouth. Porphyromonas gingivalis, that's a super nasty dude. We're going to talk about him a little bit more later, but he has some significant effects on a lot of other body organs, including the brain. Also, the disruption of the microbiome. You get intestinal permeability with leaky gut, trigger widespread systemic inflammation. and as we all know, inflammation isn't really a good thing. And right there, colorectal cancer, IBS, adverse pregnancy outcomes. So there's lots of things that cause these things, but just from those two bacteria alone, they are oral in origin. Now, something really cool is this nitric oxide pathway. When we eat foods that are rich in inorganic nitrates, like spinach, beets, heart-healthy foods, the body cannot break those down. So when we ingest the nitrates, the body doesn't know what to do with it. So what it does is it goes through, gets absorbed, it gets pumped back up to the mouth, and actually gets put into your saliva. And as you swallow, there are symbiotic bacteria living on the back of the tongue that convert those nitrates into nitrites before you swallow. And once it gets down to the stomach, it's able to be absorbed, and the body sees nitrites, and it's like, oh, I know what to do with this, and converts it into nitric oxide. And nitric oxide is this very powerful vasodilator and anti-inflammatory, which is super cool because of bacteria on the back of your tongue. I think that's just fascinating that and when you have these vasodilators, that lowers your blood pressure. That was a key point there I forgot to begin at the beginning. So you can lower your blood pressure from this symbiotic relationship. Now, real quick, this is not the only way to get nitric oxide. Your body does release some naturally in a few other places, like in your nose when you nasal breathe. Also, if you have arginine, which comes from the amino acid arginine, which comes from other foods. So, but yeah, you want to make sure that you are chewing the food thoroughly to help break down the cell walls to make sure you get all of that. So that's a fun little fact. So, what does a healthy mouth look like? Well, cavity-free, no gum disease, having properly aligned teeth, and a full complement of teeth. Now, I'll only quickly touch on those two. Properly aligned teeth. Now, there are when people start thinking about properly aligned teeth, they start thinking of orthodontics and aesthetics and things like that. Now, I am a firm believer in orthodontics for hygiene, for function, and for health. And it just so happens at the end of the day, they end to be straight. The teeth do. And so then you get the aesthetic result at the end. Because straight teeth are easier to keep clean. They don't get as much buildup around them. You do not get as much plaque or food traps. All those things lead to an unhealthy, unbalanced system. So straight teeth, easier to keep clean. And a full complement of teeth, meaning that you have a balance in your mouth. So think about a car. a car that has 4 different size tires on it. How's the ride on that car? That's pretty bad. Also, the gas mileage is abysmal. And at this point in time, you really want good gas mileage. And the tires will all wear at different rates. So if you do not have a full complement of teeth, which is the majority of us here, you tend not to have a balanced system. And so teeth are wearing faster, teeth are chipping faster, teeth are breaking faster. It causes issues with your TMJs, called TMD, and which is temporomandibular dysfunction. And so those 2 things right there, while not necessarily bacterial in nature, although this one is more of a function. And we'll talk more about function in a little bit. Also, wide open airway space, basically meaning there's space for your tongue in your mouth. If there's not space, yes. If there's space, you want space for your tongue in your mouth because that directly affects how you can breathe. An unhealthy mouth, cavities, gum disease like gingivitis or periodontitis, misaligned and crowded teeth, missing teeth, we just talked about that a little bit, and a constricted airway space, which is no room for your tongue. We'll talk more about that here in just a second, but I wanted to open this one up just a tiny bit. Constricted airway space, meaning that there's not room for your tongue in your mouth. If there's not room in your tongue for your mouth, where does your tongue go? Do you stick it out? It's not socially acceptable. So the tongue only has one place to go, and that's back into your throat. And that right there causes sleep apnea. And so that's why you want space in your mouth for your tongue. Yeah, we'll talk more about that later. So there are different categories of an unhealthy mouth, just to help, because we see all this, and great, but we like to, as dentists, we like to organize a bunch of things. And we like to categorize all of them. So caries is the disease process of tooth disease, tooth decay that causes cavities. A lot of times we'll use caries and cavities interchangeably. Just caries is the process, cavities is the result. But we still use them basically the same, which makes it just super clear, doesn't it? Gum disease, gingivitis or periodontitis, oral cancer. We're not going to touch too much on that tonight because if anybody has any questions at the end, I'll try to leave some time for questions, but just know that oral cancer makes up about 3% of cancers, and most of them are related to smoking, drinking, and some sexually transmitted diseases. So just stay away from those 3 things, and that really decreases the risk of oral cancer in a lot of categories. Occlusal diseases, which is like bruxism, clenching, grinding, missing teeth, misaligned teeth, TMD, which is what I meant when I was talking earlier about the TMJs are your joints, temporomandibular joint. TMD is temporomandibular dysfunction. So whenever you have clicking, popping, or discomfort in your jaw joints, it's TMD. So I had a professor in school that was her. There is a specialty that just teaches that, and she was adamant that I correct all of you. That you do not say I have TMJ, you have TMD. So anyway, and then airway, being that the mouth is the entryway to the respiratory system. Boop, boop, boop. Cool. So let's talk about cavities for a minute. The stages of tooth decay. You've got enamel decay. So there are 3 layers of a tooth. Enamel, which is the white part that everybody sees. Dentin, which is the layer underneath. Oh, enamel is also the hardest substance in the body. Dentin, which is just underneath the enamel, is much softer. It has more of a yellow hue. To people that have yellowish teeth, the dentin is shining through the enamel more. Also, as time passes, the enamel wears away and the dentin shows through more, and so that's why as we age, our teeth maybe look yellower. And then the 3rd layer is the pulp, the nerve of the tooth, and that's where the blood vessels are and the nerve. So enamel decay is right on the top surface. Those are called incipient lesions. There's a ton of name for them. When a decay is in that surface layer right there, you might have seen some stuff about remineralizing teeth and stopping tooth decay. This is the only stage that we can predictably stop decay, is when it's in the enamel, when it's in that surface layer, and we can remineralize it. Because what happens is when it progresses here and gets to the dentin, it travels so much faster, and it's a more nutrient-rich area. And so the bacteria are like, delicious, let's go nuts. And they start heading straight for Oh, there's it is, dentin decay. Straight for the pulp, straight for the nerve. And that's where you start getting infections, needing root canals, having teeth taken out, stuff like that. We won't get too much into that tonight. So there's this different stages of that. There you go. There's just more of it. There are basically 3 types of cavities. There's pit and fissure cavities, smooth surface cavities, and root cavities. Root cavities are my least favorite because they tend to be underneath the gums or right at the gum level, and those are more difficult to keep isolated, to keep them dry. They're much closer to the nerve. See that? Like, it's right there. So you're more likely to have sensitivity afterwards. Also, the root surface is incredibly difficult to get filling materials to stick to. So typically when you get this, especially to here, the tooth ends up having to come out, unfortunately, because saving it is more of a headache for the patient than it is, it ends up being more of a headache for the patient. Yeah. Now, this right here, you can quote me on this. You can take pictures of this. Cavities are caused by bacteria, not sugar. That is very exciting. So have cookies, have candy, eat ice cream. That's all. No, but it's true. They're not. They're not caused by sugar. They're caused by bacteria. The bacteria is called Strep mutans. Strep mutans is a not very delightful person or bacteria. One other fun note about Strep mutans. It's contagious. So babies, for example, we'll keep it PG here. Babies are free of strep mutans. They do not have it. It is not something you're born with. It is not something you get when you're born at birth. It is given to you by loving family members who give you kisses and by drinking after them and eating after them. So when someone has a bunch of cavities, you have a bacterial infection. There's lots of different treatment methods out now trying to figure out how to treat this, like with mouthwashes that include bleach and chlorine and all sorts of stuff. Suffice to say, there's nothing that's a standard of care yet, but there's lots of anecdotal evidence for those. Now, really interesting about strep mutans, it thrives on simple sugars and carbs. Now, I said sugar doesn't cause cavities. However, cavities have a lot of simple sugars and carbs. Sugar has a lot of simple sugars, like candy, and carbs. So candy, cookies, sugar, that's like giving a very hyper child a Coke. Does that make sense? So giving bacteria all this stuff makes them just go wild. They love it. And what happens is when they get these sugars, now, hold on, I'm sorry, I'm getting ahead of myself. These simple sugars and carbs are, yes, they're found in candy and ice cream and cookies, all these delicious things, but they're also found in chips, breads, and crackers. All those things have it too. So when you are making a healthy decision and saying, I'm not gonna have the cookie, I'm gonna have these crackers instead, guess what? The bacteria see that as the exact same thing. So you're still gonna get cavities. The bacteria, as they eat all of this, they produce lactic acid. Lactic acid has a pH of 3.8. 3.8 is very acidic. Really quick, the mouth tends to be in a range between, a healthy mouth is anywhere between 6.7-ish, 6.5 to about 7.6. So it's a neutral balance. As soon as you get lactic acid production, locally, and then the other thing is that the mouth, the teeth start to dissolve at a pH of 5.5. So if you have bacteria on your teeth producing 3.8, and then you've got a tooth that dissolves at 5.5, that's how you get cavities right there. And what's also, right there, good job. What's also interesting is that this 3.8 brings the whole pH of the mouth down from a neutral pH to one that's right at the 5.5 and sometimes below. So, and then there's other things that factor into pH, like your saliva. Some people have more acidic saliva, and unfortunately that puts you at a higher propensity to develop cavities. And then we talked about strep mutans being contagious. Now, bacteria cause these cavities, right? However, strep mutans, while it cannot survive the stomach, it can survive the bloodstream. And what happens is that Strep mutans gets into the bloodstream through bleeding gums, through dental procedures, through brushing, through eating foods that might cut your gums, through the sublingual capillaries, and it can travel through the heart valves and get all the way to the heart. And it likes to adhere to damaged heart tissue, like heart valves. This bacteria, Strep mutans, loves heart valves, and it causes infective endocarditis. So this infective endocarditis affects the prosthetic valves, congenital heart defects, and also if you have a history of rheumatic fever. And it builds up this stuff called vegetation. Now, the heart is a very delicate and nice, important organ, and I think Dr. Bailey, who was here last, would agree with that. But any damage to the heart is not good. And especially if you've had a history of heart disease before, which in America, you're more likely to have heart disease, this is really bad news. Because this just further damages the heart, weakening it, leading to, and your symptoms start off with like flu-like symptoms and then slowly just start to build. So this is a fatal disease. And it can happen to anybody. I had a classmate in dental school who started having flu-like symptoms, went to the hospital, they checked her out, she had infective endocarditis. She was 26. And so for the rest of her life, she has to take antibiotics before she goes to any dental procedures, and she's a dentist. So it's anybody. So there's some stuff about infective endocarditis. This next one here, I know I'm going a little fast, but I was looking at the time, and I still have a lot to cover, so I'll try to be quick. This next one here really shocked me. Strep mutans, they're finding in patients that have had brain bleeds, specifically hemorrhagic strokes, they're finding strep mutans in the brain. It crosses the blood-brain barrier. It's specific strep mutans, not all. They're finding post-mortem studies that 20 to 30% of patients that have had this hemorrhagic strokes, a brain bleed, had a collagen-binding protein version of strep mutans. It's called CNM positive. And what this CNM positive strand of strep mutans does is it binds to damaged blood vessels in the brain, making them leakier so they bleed easier. Damaged blood vessels in the brain aren't necessarily from drugs or anything like that. It can literally just be just age, unfortunately. So, but this right here, the American Heart Association just released this information in 2020. So this is only a few years old. So now, when we start talking about people having cavities, it's like, well, it doesn't hurt me. It's like, well, it might not right now, but this is definitely something that we should take very seriously. This one still messes with me because, like I said, this is new since I got out of dental school. Anyway, and one other note is that this is talking about the brain bleeds, not the full like cerebrovascular attacks where you have blocked blood vessels. This is specifically brain bleeds. So, now what risk factors are there that cause cavities? Well, there's plaque buildup, which is just normal accumulation of biofilm and food debris that happens over time. Poor oral hygiene. Oh, real quick on plaque buildup, some people are just more prone to it, unfortunately. Poor oral hygiene, which leaves the plaque buildup. Frequent snacking and sipping. What they've found is that, so back in the 80s and 90s, public health got really good about explaining to all of us that we needed to floss and brush multiple times a day and we would get no cavities. That didn't work, as I'm sure we all know. We flossed and brushed and we still got cavities. And so they went back to the drawing board and they're like, well, what's causing this? And they found that frequent snacking and sipping is a big cause of that. Basically, I'll touch on this more later, that frequent snacking and sipping resets your mouth pH over and over and over and over again throughout the day, so your body doesn't get a period of time where it just gets to rest and just be at neutral pH. And think about it like this: if you take a tooth and you have it in an acidic environment and it neutralizes, and then you sip something and it resets it to an acidic environment just over and over again, that tooth is always going to be softer, and so you're always more prone to cavities. And we'll probably talk about that more later. Dry mouth, big cause of cavities. And it's a common side effect of a lot of medications. Dry mouth makes it so your body doesn't have the saliva it needs to flush and clean out a lot of plaque. And then also, unfortunately, restorations. So that means fillings. So fillings, crowns, and bridges put you at a higher risk of getting cavities. I know. It is daily that I have this conversation with patients where I tell them, I'm sorry, you've got a cavity around this crown, and they say, well, I have a crown, how could I get a cavity? It's like, well, unfortunately, it doesn't encapsulate the entire tooth. So what happens is that as soon as you grind on a tooth, as soon as you touch a tooth with a handpiece for a filling, a crown, whatever, you have permanently damaged that tooth, and that tooth is always more susceptible to cavities. Because if you think about it like, I'm trying to think of an example. Whatever, we'll just use my fists. So pretend this is a tooth, this is a crown, and they meet like this. There's still a gap. We do everything we can to close it. We do absolutely everything we can to seal it off and make it perfect. But unfortunately, there's still a gap. And there's still a change in surface texture from tooth surface to porcelain or composite or whatever. And so that is an area where plaque builds up, and bacteria like to live and cause cavities. So unfortunately, once we've done the filling or crown or whatever to fix the cavity, well, unfortunately, you are now at a higher risk of having to need another one. So it's a catch-22. All right, so gum health. This is one I really wanted to talk about. The gums are probably the most important part of your body. Well, the mouth. I think the brain and the heart might be a little bit more important. But the gums are probably the most important of your mouth because they're the foundation of the mouth. They're the foundation of your teeth. It's very, very complicated. You've got the bone, which helps anchor the teeth. You've got the periodontal ligament, which is actually a membrane that surrounds the root of the tooth. It's like a shock absorber. There's nerves in it. There's tons of fibers. There are millions of fibers connected to each tooth that are going this way and that way and ups and downs. And they keep those teeth in the socket site. The gums shield the jaw bones, and they perform a protective seal against food and bacteria in the rest of the body. So the periodontium is this area right here. Gingiva, periodontal ligaments, cementum, which is the root surface, and the alveolar bone. So healthy gums, they have a good color. They're pink. They don't bleed. Your probing depths are between 1 to 3 millimeters right there. That is just delightful. They're not loose, and you have no recession, showing off the root surface. There is a thin band of tissue right here called the biologic width that is 2 millimeters wide. Those 2 millimeters separate your mouth from the bone. It's just 2 millimeters, that's it. Unhealthy gums, you get more of a deep red or a purple color. You get bleeding, probing depths at or greater than 4, mobility, teeth being loose, recession, you get root exposure. Root exposure is nasty because the root is much softer, it's more porous, you're more likely to have sensitivity with things like that, and it's a much rougher surface, and so it builds up stuff more, so you get even rougher of a surface. And like I said earlier, when that's exposed and you have to do fillings, ugh, those are hard. Those are hard. And also, gum disease is the #1 reason for tooth loss. Not cavities, not trauma, just from losing the foundational support around the tooth. So a normal tooth, there's a tooth outline here, I promise. You've got this little system right here. Here's the blood vessels, nerves, bone, everything that looks healthy and good. And then periodontitis, which is advanced gum disease. You get bone loss, and the bone starts to die, and here's another little stepwise process. Healthy gums to gingivitis to periodontitis to advanced gingivitis. So just real quick, we're going to do some pretending here. Pretend my fist is a tooth, my arm will be the root, and my sleeve here is going to be the gum tissue. Throughout the day, you get plaque buildup on your teeth. Plaque is, it's the white sticky stuff that you can floss and brush it off. You can scrape your tooth and get some off too. Anyway, that's plaque. You can, like I said, you can floss and brush most of that off. However, you can't get all of it, so you still got to go in for cleanings because we have special tools that can get it out. Well, not me, the hygienist. You don't want me cleaning your teeth. I'm used to my patients being numb, so. Anyway, but if that plaque stays there for too long, it turns into calculus. Plaque hardens and adheres to the tooth like a barnacle. And we'll pretend my watch here is the calculus. And what happens is that it lives right under this. And then you think about a rock in your shoe, it's pretty uncomfortable. You can't not pay attention to it, causes a lot of irritation. Same thing happens with this. You might not feel it because it's small, but your gums can tell, and so they will bleed, they get inflamed, and what happens is, remember that 2 millimeter biologic width I told you about? When you've got calculus right here, it completely degrades that biologic width, and the bone is now exposed to the mouth. So now, remember this is gonna be the bone, it's now exposed to this little splinter of bacteria, and so the bone starts to die away. And you start losing a lot of bone support, and those teeth start getting loose, and then they start having to come out. Removing teeth that are affected by gum disease is very easy to do, but it's very sad, because the tooth is fine. It's just the environment that it's in. So, the thing is, though, about periodontitis is that it's a slow-growing thing. It doesn't happen quickly. It's not overnight. We're talking like months, sometimes years. And unfortunately, once you've been diagnosed with gum disease, you're pretty much a gum disease patient for life because it can come roaring back. I've had plenty of patients who I've had this conversation with and tell them, like, hey, we got to stay on this. We don't want this to come back. They disappear because life happens. I'm not faulting anybody for that. But the next year they come back and all the pockets, like they're back to here again. And we have to do another round of cleanings to get them cleaned up again. Now, there are different types of cleanings that are appropriate for the different, is it next page? Yes. That are appropriate for the different types of gum disease. Prophies, scaling and root planing, periodontal maintenance, gross debridement, scaling and presence of inflammation. So I have a handy dandy chart here that AI helped me make. Thank you, AI. A healthy gum gets a prophy, healthy cleaning. That's your normal, typical, just get in there and get it done. Gingivitis, where you've got bleeding gums that no bone loss yet, but gums are bleeding very easily. This typically happens with someone who hasn't been to the dentist in a while or has poor oral hygiene. They frequently will get scaling in the presence of inflammation, which requires follow-up subsequent visits. And from this cleaning, you can either go to periodontitis or healthy gums. Thankfully, most patients, if they develop good habits, oral hygiene habits, they can drop back down to just a regular cleaning. Periodontitis requires scaling and root planing. Those are deep cleanings. Those are the ones you have to get numb for. Those ones take a few appointments. And what I always tell patients is that my hygienist is going to keep you on a short leash. She's going to want to see you at least 4 times for at least this year to make sure it doesn't come roaring back. The goal is to get you to just regular cleanings once every 6 months. Because that means that we've done our job. That means that your gums are healthy and your teeth are in a good environment. So let's get you back. Let's get you back up to something more healthy. And then too much buildup to diagnose is a gross debridement. And those patients typically end up in dentures. Now, sometimes at a gum diagnosis, patients will ask me, or my hygienist, like, can we just do a cleaning? Can we just do a cleaning? Even though they're here in periodontitis. And that's like, unfortunately we can't. Because that's like asking your dermatologist to scrape off part of the melanoma, but not all of it. That's what doing a regular cleaning is like, instead of trying to get all the bacteria and stuff out. So we've focused mainly so far on how it affects the tooth, localized, and how we lose teeth to gum disease. But how does this affect the rest of the body? Because it is not isolated to the mouth. Remember, the gum tissue, bleeding gums, bam, you're right into the bloodstream. And then also, those 2 bacteria we talked about earlier, the fusobacterium and the Porphyromonas gingivalis, survive the stomach acids. So, gum disease directly affects all of these: cardiovascular disease, diabetes, dementia, Alzheimer's, rheumatoid arthritis, and cancer. We're mainly going to focus on these upper 3 in the interest of time because, man, I am taking forever. Healthy gums equal a healthy heart. Chronic inflammation means porous gums, which means it's easy, which is allows more bacteria into the body. Inflammation of the vessel linings, you get plaque accumulation in those. Gum disease leads to an increased risk of heart attack by 30%. So there's another reason that we really strive for having a deep cleaning to get all that stuff out, so we can help decrease the risk of heart attack and stroke by 2.5%. That is not the type of stroke we were talking about earlier, the brain bleeds caused by that are affected by a different bacteria. And then in diabetes, 3 to 4 times more likely to develop severe periodontal disease, diabetics are. Higher levels of blood sugar are a constant food source for the bacteria. The accumulation of AGEs, you get damaged blood vessels in the gums, and you impair white blood cells. What's tough about diabetes and gums is that it is a vicious cycle. Diabetics, like I said, are more times. So the diabetes is harming the gums, and the gum disease makes the diabetes worse. Severe bronchitis creates a massive chronic wound in your mouth. I've read that affected gum disease is like having a wound the size of your palm in your mouth. It's just localized to each little tooth, but if they were to combine them, it'll be the size of your mouth. And diabetics struggle with healing, so that it's a constant battle. And also what's interesting is the chronic wound releases cytokines, which interfere with insulin receptors, making cells even more resistant to insulin. So gum disease makes your diabetes worse. And they found that effective periodontal therapy can lower your A1C by 0.5%, which is pretty significant. So diabetes and gum disease go hand in hand. That's why we need to treat gum disease. This one right here, the mind-mouth connection, Alzheimer's and dementia. So chronic systemic inflammation causes the blood-brain barrier to become leaky. It's easier for bacteria and pathogens to pass through into the brain. Porphyromonas gingivalis, which is the keystone bacteria for severe gum disease, travels through the bloodstream and actually up the cranial nerves as well, and get into the brain and secrete gingipains. Gingipains feed on human tissue. And they're finding gingipains in deceased Alzheimer's patients. They have found that gum disease can lead to a 25 to 65% increased risk of Alzheimer's, just from gum disease. And there's no cure for Alzheimer's or dementia. So if you've been diagnosed with gum disease or a loved one, and they have Alzheimer's, or they have Alzheimer's or dementia, suddenly getting a deep cleaning isn't going to fix it, because the damage is already done. So prevention is one of the best ways to prevent that, is to help. Yes, so excellent oral hygiene, regular dental visits help that out significantly. I'm trying, Rhoda. I'm trying to go as fast as I can. The silent epidemic, airway, sleep, and structural health. So when we sleep, remember we were talking about airway space and your tongue. When you sleep, your tongue falls back into your throat, you start to snore. My wife tells me I do this. I'm sure nobody else has that problem with their wives telling them they snore. But you lose that natural muscle tone, and as the tongue falls back into your throat, your body naturally is trying to open your airway back up, so you're more likely to clench and grind and throw your teeth forward like this to try to get your tongue out of your throat, and it'll just grind your teeth down significantly. And you start developing, like I said, obstructive sleep apnea. And it can be dozens of times an hour where you stop breathing. And then sleep apnea is, a lot of dentists are now treating this. We can treat it in specific ways. The gold standard with sleep apnea is a CPAP, but if you have mild to moderate obstructive sleep apnea, you can be treated by your dentist with something called a mandibular advancement device, which helps manually hold your jaw forward. As with anything in medicine, it's not necessarily going to work if you have mild or moderate obstructive sleep apnea, but it's worth a shot. It's easier to travel with than a CPAP. And as you know, with sleep apnea, causes a lot of cardiovascular strain, leads to GERD, and like I said, leads to TMJ pain, or TMD, as I've taught you all now. Typically, whenever a patient comes in, they're like, oh man, I'm clenching and grinding. My first question is, well, how's your sleep quality? Because there's 3 reasons that we clench and grind our teeth: stress, a side effect of antidepressants, and a sleep-related breathing obstruction. It doesn't have to be full-blown sleep apnea. It can be something called upper airway resistance syndrome, which is basically not a good sleeper, a light sleeper. You're not necessarily having the apneic events, but your brain isn't able to get into your deep sleep and rest. Typically, when I have patients that do that, I am partnered with a couple sleep physicians, and we start working about sleep studies and things like that. The pediatric airway. This is something that's very near and dear to my heart. This is actually my son. You can kind of see it, but he's got this sweet curly mohawk. He's doing okay. But the thing is, a lot of the issues that we run into with anatomy of airway collapse here can be treated in the pediatric population. And I treat a lot of kids that we can see the signs of sleep apnea starting to develop, and we can treat them at a much younger age, hopefully, diminishing their risk of developing sleep apnea later in life. It's a very complicated system. It involves the breathing through the nose, tongue placement, frental attachments. It's pretty exciting. But I have felt very fortunate to be able to treat quite a few patients with that and at the pediatric age, and it's been really cool seeing them completely turn their life around. For example, just a quick side note. I had a patient, she was 9 years old and still wetting the bed. She never slept through the night, and her mom complained about it a lot. And she, didn't sleep through the night, wetting the bed, everything like that. We treated her, and in 2 weeks, she was no longer wetting the bed, and she was sleeping through the night. That was a big deal. I get a little emotional with that one because it was amazing seeing the mom's thrilled and the child's beyond happy because the 9-year-old that's wetting the bed is a little embarrassing. And now she doesn't need to worry about that anymore. She's not having to wear pull-ups. Anyway, and just one quick side note because this is something I'm really passionate about. You remember back in the early 2000s, Ritalin and ADD and ADHD was a big deal. So what they used to do back then is any child that was somewhat hyper was told that they had ADD and they needed to get put on Ritalin or some other medication like that. The medication, I feel very fortunate, real quick, I was not put on any of those medications, and I'm very grateful for that. But I had a lot of friends that were. And what that did is it helped kids focus in school, but their sleep quality was still abysmal. And so they still had poor airway and sleep apnea as children. And it wasn't until, this has been the past 10 years, where now, if a child is diagnosed with obstructive sleep apnea, if a child is diagnosed with ADD or ADHD or suspected, they need to have a sleep study done first. It is sleep apnea until proven otherwise. So, that's a big deal. All right, I'll wrap it up here. The impact of lifestyle and nutrition, the chemistry of eating and oral flushing, the pH battle. Your mouth is constantly under attack by food, by bacteria, by saliva, by chewing, by anything. And it's always in flux. Remember, a neutral environment is the best, but we eat so many things that lower the pH and make our teeth dissolve. For example, Coke. Does anybody know what the pH of Coke is? 2.5. Do you know what your stomach acid is? Anywhere between 1.5 to 3.5. So Coke and stomach acid are right on the same playing field. So if you're drinking Coke or Mountain Dew, as we do in Tennessee, or sweet tea, super acidic, and that just starts dissolving your teeth. It takes roughly 2 to 4 hours, I think I mentioned this earlier, but it takes roughly 2 to 4 hours for your mouth to get back to a healthy pH after eating or drinking something. So, for example, if you, excuse me, say you have some food at lunch and your pH is all out of whack, so it's super acidic. You're on the time starts. You have 2 hours, 2 to 4 hours for that pH to get back to normal. However, say an hour after eating, you're like, I'm gonna have that Little Debbie snack. Congratulations, it was delicious, but you also just reset the clock. We're 1 hour into your 2 to 4 hours, now you've just reset it. So it has to do it all over again. So it's this constant battle. Awesome. So snacking on things like sweets, starch or refined carbs, sticky foods, acidic foods and drinks, all of those things make it more acidic. So luckily, though, God, in his infinite wisdom, gave us what we call nature's toothbrush. And I'm dead serious, this is what we learned in school, and this is what they said. These are nature's toothbrush. Specifically, the carrot. The carrot is wonderful as a toothbrush. So are apples, broccolis, cauliflower, celery, and cucumbers. I know people will argue about broccoli because the broccoli little pieces like to get stuck in your teeth, but it's too complex for the bacteria to break down, so you might have something stuck between your tooth, but don't worry, it's not causing a cavity. And things to avoid. These are foods and habits that directly affect the body. You get sugary sweet foods, fizzy and sugary drinks, acidic foods. Now, I'm not saying stay away from grapefruit and oranges. Those are great and have a lot of potential, a lot of good things. But just know that after you eat them, your mouth is very acidic. You do not, eat your oranges, your grapefruit, whatever, but don't brush your teeth for at least 20 minutes. Because if you eat that, your mouth is crazy acidic, and you're brushing your teeth in an acidic environment, that'll wear away the enamel. I do not recall what the acidity is. I think it's around 2 to 3 on a lot of citruses. Starches, alcohol is really bad for dry mouth. Smoking is just absolutely abysmal. Clenching and grinding wears teeth down, breaks them. Chewing hard objects like pen caps, ice, even the Chick-fil-A ice, and Petro's ice, which are hard to say no to. Nail biting is really bad. I had a patient who was a roofer, and he would keep his nails between his teeth, and so he had a sweet little notch right there. He didn't want us to fill it because that's where he continued to keep his nails. And also, using your teeth as tools. Opening up packets, sauce packets, like Taco Bell sauce, or salt packets with your teeth is literally it's like nails on a chalkboard to a dentist. Please don't do that. And definitely don't open up a bottle with your tooth. That is, unfortunately, that still happens. So some hidden influences on oral health. You've got medications. All of these, decongestants, antihistamines, painkillers, water pills, antidepressants, inhalers, all of those cause dry mouth. And because this is America, and in our healthcare system, we like to prescribe a lot of medications, most of us are on maybe one of those. I mean, I took an antihistamine an hour ago. So, and I'm talking, so my mouth is super dry. Low vitamin D, really critical, especially in kids, because they're still developing the bone and the teeth. Physical activity and weight, getting your blood pumping helps circulation. It helps salivary flow, and those different things are helpful. And also tooth loss, like we talked about earlier. You start losing teeth, the whole mouth system just gets completely out of whack. So daily habits for your oral and systemic health, the essential dental toolkit, a soft bristled toothbrush. If you have a medium or hard bristled toothbrush, go home and throw it away. That toothbrush, or actually put it with your cleaning things. It's really good for cleaning grout. But not your teeth. It's awful. Electric toothbrushes, very helpful. It depends. Some patients are better with either or. I personally am better at this than this, but I have some patients that desperately need this. It just is a little bit more help. Quick side note, with electric toothbrushes, you don't brush with an electric toothbrush. You just gently move it along your teeth. It does all the work for you. Toothpaste, of course, is very helpful. Although if you don't have toothpaste, brush with water. Just that friction is getting something off. Didn't put it in here, but not all toothbrushes or toothpastes are made the same. Whitening toothpastes, it's a scam. Don't buy into it. They sometimes are helpful with extrinsic staining, but they tend to be more abrasive and can put more scratches into your teeth, leading to more staining. And then you want more of the whitening toothpaste to cause more scratches on your teeth, to cause more staining, and so on. And then you get to have veneers. So maybe you should, no, I'm just kidding. Dental floss or brushes, very important. Occlusal guards, if you're a clencher grinder, it doesn't stop you from clenching and grinding, but it at least protects your teeth. And a mandibular advancement device, like I talked about earlier, these two are not for everybody. These are. A mandibular advancement device is helpful if you're struggling with sleep apnea. Or a MAD is another name for it. So a daily standard of care, brush for 2 minutes twice a day, floss at least once a day, an alcohol-free mouthwash. There are some studies that show that alcohol-based mouthwashes like Listerine actually increase your risk of oral cancer. There's not a causation yet, but it's common, it's showed up enough in studies that enough people are like, probably shouldn't use that. Also, alcohol-based mouthwashes kill more good than they do bad. I always remember the ad from, what was it called? Listerine. They had a video, or they had a little graphic where they would show all the bacteria living between your teeth, so scary. Then you swish with Listerine and they all die. Well, unfortunately, it kills all the good stuff too. Also, hydrogen peroxide. Some patients love to use hydrogen peroxide, but it does the same thing. Kills everything. Kills the good stuff too. There is a time and a place for a hydrogen peroxide-based mouthwash. That's with mouth sores, like if you've got really bad canker sores, whether that be from a cold sore outbreak in your mouth or a really bad canker sore. Those do help, but only for about 2 weeks. And just there's a few at the drugstore. Cleaning between your teeth, like with water flossers, for example. Eating well and less frequently. Snacking, like I said, bad news bears. Exercise is helpful. Don't use tobacco and limit sugary drinks, because sugary drinks, we tend to sip on those for a long time. Typically, someone doesn't just chug it. And so those can, influence the pH balance. And then see your dentist, so that way we can help you stay on those paths. If your toothbrush looks like this, that's not even good for grout. So it's like, I had a patient who I gave him a toothbrush. I gave him an extra soft bristled toothbrush. He came back 2 weeks later, and this is what it looked like. Anyway, that's all. If you have any questions, I am all ears.
Okay, well, I thought that was extremely good. Thank you. It's interesting. When we were planning a meal for today, I said, Ruth, we need to put a carrot on each plate, the natural toothbrush, and then we forgot. So that's too bad. Anyway, are there any questions? Okay.
Chewing gum, like
Yeah.
sugar-free chewing gum, is
Sure.
it good to, like, if you can't get to a toothbrush, to chew gum?
Depends on the ingredients. Some chewing gums like Juicy Fruit or Bubblicious, no. They do stimulate saliva, so they're helpful, but you're looking for gums that are xylitol-based. Number one ingredient is xylitol. That's spelled, I don't know, has anybody heard of that word, or not heard of that word before? Xylitol, it's spelled Xylitol. Beautiful stuff. You can buy it in bags at some health food stores. Don't do that, because if you have too much of it, it will give you loose stool. So don't want to do that. I had a professor in dental school who was given some chocolates that were sweetened with xylitol. He had no idea. Ate a whole bunch of it. He found out on the airplane. So don't do that. Also, xylitol is dangerous for dogs. But xylitol icebreakers, well, you can get some gums like Spry, and there's a few others that are just like, sorry?
Pur is
Pure, yeah, P-U-R, Pur. Those have very high concentrations of xylitol, very good. They're a little bit harder to find sometimes. So if you're at the drugstore, the gas station, or a grocery store, Icebreaker ice cubes, they have the highest concentration of xylitol per piece. So those work really well, and they have a ton of fun flavors. If you're dealing with TMD, try not to chew too much gum, because that can exacerbate your muscle joints and your muscles and make your headaches and migraines worse. So.
Go ahead.
First of all, thank you for answering why my blood donor is deferred for 3 days when I've been to the dentist for cleaning. I was wondering why. And second of all, years ago when I was a kid, somebody took a piece of steak and put it in a glass of Coke. And left the next morning.
Yeah.
So I said, okay, like my stomach.
Yep. We did a project in school where we took a tooth and actually put it in Coke, and we left it, I think we left it for a week, and it came back and it was just stripped of enamel. So.
A few days ago, I read something about if you're on some medication, and I don't even know how to put the question, that let's say I was going to have surgery for something and I was on some medication, that you should also see your dentist. And I think they were trying to do some relationship to it would do to your teeth. I just can't remember the details. Have you ever heard any kind of thing
There are
like
quite a
that?
few medications that can negatively impact your mouth. Most commonly, they're bisphosphonates, like Fosamax, and then what's the other one called? Is it Prolia? Yeah, Prolia. They can negatively affect the bones of your jaw that surround your teeth. And so a lot of physicians will want you to get checked out first to make sure that you aren't going to lose any teeth while on that medication, because that medication will interfere with the bone healing, and you'll be left with open wounds in your mouth and exposed bone. So that's one of them. I'm wondering, does that sound familiar at all? Okay.
Can you briefly explain if there's different complications and dangers of getting root canals?
Sure. Root canals is a very touchy subject. And there are lots of theories on those. As far as root canals go specifically, it's a case-by-case situation. The more infected a tooth is, the more likely that root canal is going to fail and have problems later. If a tooth is dead and you open it up and there's no blood, no nothing, you're more likely to develop further problems later on. Roots, the tooth is not an isolated system, and roots are not solid. They are very porous. I wish I included it, but I have a picture of a root that was sliced and electron microscoped after a root canal was done, and you can see where they've done the mechanical and the chemical cleaning of the inside of the tooth, where it's leached into the tooth itself. Root canals, man, they're tricky, because in situations like that, it's not, what's the word? It's not a sterilizing procedure. It's a sanitizing procedure. The most successful root canals are the root canals done on healthy teeth. The least successful root canals are the root canals done on sick teeth, because the bacteria are already infested into the tooth itself. Now, we do start running into some complications with what do we do with the tooth that has a nerve infection. So your options, so just real quick, if you have a tooth that's been infected and it has abscessed or is abscessing, there are 4 options. One is to do nothing, just let it be, which is a horrible decision, because that just leaves that infection fester and grow. You can develop something called Ludwig angina, which is where you have where the bacteria gets into the fascial space underneath your tongue and can swell, and you can suffocate and die. In dental school, they told us we might see 1 in our entire career. When I worked in public health, I saw 6 in 6 months. And the only treatment is to get them to the ER and do IV antibiotics and pray that you don't have to do a thoracotomy, or whatever it's called. So with root canals, the other option, like I said, so do nothing, bad idea. Take the tooth out and do nothing. Take the tooth out and do an implant, or do a root canal. Those are your options if you have an infection. Now, I will recommend, based on the situation of the patient, different things. I do recommend root canals for certain patients. Typically, it's younger patients and it's front teeth. Because as soon as you lose a front tooth, younger individuals care a lot about aesthetics. And as soon as you lose a tooth and you have to go to an implant, the aesthetics are not the same. Implants do not support the gum and bone as well as a natural tooth does. So if the infection's not too crazy, if it's not abscessed and awful, then I'm going to talk to them about a root canal. And we'll monitor that thing like crazy. We take x-rays of them every year to make sure they're not developing further infections. And the purpose is because as soon as you remove that tooth, that bone structure is completely forever altered, and they're never going to have that back. So it's kind of one of those things where it's another one of those catch-22s. So if someone's had a root canal and it's gotten reinfected, take it out. Don't do another root canal. If you do another root canal, a retreat root canal, now I would get in trouble with some endodontists on this, but if you have an infected root canal and that tooth, let me back up. If you have a tooth that has a root canal on it and that tooth gets reinfected, if you redo the root canal, the tooth is going to be more painful, and you're more likely to fracture the tooth. So I don't recommend redoing root canals. So anyway, I hope I answered your question for the most part. Yeah, sorry.
What's your opinion of fluoride? One question. Second question, what about toothpaste with activated charcoal?
Sure. Okay, so the easy one is activated charcoal. No. Charcoal is very abrasive, and it scratches your teeth like crazy, and you're going to get more stain later. Fluoride. Fluoride does harden teeth. However, this is a little anecdotal. When I practiced in California, and I was in public health too, practiced in a non-fluoridated community. There was not fluoride in the water. When I moved to Tennessee, fluoride in the water. And from my patient populations that I saw, I went from private practice and public health to a fairly, bougie practice in North Knoxville. And the incidence of cavities was the exact same. The people in California without fluoride in their water had the same amount of cavities as the people with fluoride in their water in Tennessee. And while it's hard to say no that a lot of these studies don't harden teeth, fluoride is still a neurotoxin. Too high of levels, awful. And it's interesting because when fluoride came onto the playing field in dentistry, everyone was thinking, oh, this is great, this saves teeth, it hardens teeth. But what they don't mention is all the things that changed at the exact same time. Fluoride came in toothpaste. We also got much more aggressive in explaining to patients that they needed to floss and brush. And so people got better at that sort of stuff. And then also, the EPA started putting higher standards on water before fluoride was put into the water. Also, we started having, this is funny, I was talking with a friend of mine who's an orthodontist about this just recently. Refrigeration became more common around the same time too, so our food quality got a little bit better. So the fluoride in toothpaste and just your over-the-counter toothpaste is not really doing enough to really cause a big difference. And the fluoride in water, no. Because in order for fluoride to work, it has to sit on your teeth. So I don't know if that answers the question for you. Okay. This is fun.
We eat a lot of fermented foods, which is really good for your gut, but it's real acidic. So what's your opinion on that as far as your teeth?
On what? I'm sorry.
Acidic foods,
Acidic
like
food?
fermented foods.
Fermented foods. It's acidic in nature. So it's as long as you're not letting it sit on your teeth, honestly. So there was a study done years ago where they took a group of people and measured the bacterial activity of their mouth. They had them all eat some food, and they had some chocolate cake at the same time. And they measured the bacterial activity. Then they took the same group, had them eat food, measured the bacterial activity, then waited some time, I think it was, might have been an hour, and had them eat chocolate cake and measured the bacterial activity then. And the bacterial activity was the exact same. But the group that had the delay, the bacteria were more active for longer. Does that make sense? So like with fermented food, if we're doing it at a normal mealtime, if you're doing proper oral hygiene, it should not be a problem. Yes?
It sounds like enamel loss is a pretty serious situation because the layer underneath is softer and more porous. If there has been enamel loss on the teeth, can that be restored?
That's a great question. Let me ask it this way. Let me see if I understand this correctly. So what you're asking is, can you regrow enamel? Unfortunately, no. You can remineralize it to harden it again, but the ameloblasts are not active any longer. They're active as the tooth bud is forming, and that happens just gestation and when you're very young. If you can get dentin to regrow, which is underneath it, and that's through a process of the odontoblasts, which are still active, they can lay down new dentin. And that dentin, if it's close to an insult, a cavity or decay or something, and you get it at just the right time, it can harden and turn into sclerotic dentin. And that is much harder than regular dentin. But unfortunately, we can't get enamel back. Does that make sense? Okay.
Okay, one last question.
You talked about the bacteria that gets into your body and does all this havoc. If you have that bacteria in your body, is there any way to control it? Mm-hmm. If you happen to have that?
That's a great question. That's a great question. There is a lot of people trying to figure that out. The best thing to do, if you have a healthy body, or let me back up. What's the source? Where are the bacteria coming from? How can we treat them? Are they coming from the teeth? Is it bacteria from a cavity? Get the cavities out. Get the decay taken care of. Get the decay removed so the bacteria don't have a little commune to produce. Get the bacteria out of the mouth, whether that's through cleanings or deep cleanings or some chemical therapy with mouthwashes and things like that. Once it gets into the body, if your immune system is chugging along pretty good, it should take care of it. But there are some companies that actively target the bacteria circulating in your bloodstream, and their main path of treatment is antibiotics. And there's a discussion ongoing about whether that is necessary or whether just letting the body naturally phase out those bacteria because they're not having if the source has been destroyed. Does that make sense? So I had a dental school professor who for all of his patients, he doesn't do this anymore, but he would have patients spit into a cup, he would send it to a lab. The lab would tell him which bacteria they had, and then he'd put them on antibiotics. Antibiotics are a very powerful tool, but they've been overused significantly. So, especially when it comes to dental infections. So, makes me a little wary, but anyway.
Well, thank you so much. That was excellent.
Perfect.
Yes, please, let's give him a hand. So I see the hour is getting late, and I want to let you all go home, but I want to remind you of the Dinner with the Doctor next time, September 8th, by Dr. Jeremy Buckworth. He's a physical and rehabilitation physician, and he will come from Asheville for us. So I don't want you to miss that. Light is medicine. As we study and have more understanding, we realize that sunlight is extremely important for our health. So you won't want to miss what he has to offer. So September 8th, we will see you again, and we're so glad you came tonight. So before we go, let's pray together. Dear Father in heaven, thank you so much for bringing everyone here again tonight and for this wonderful presentation that helped us to understand about our oral health and how important it is for our whole body to keep a healthy mouth. Please help us to remember this information that we learned and to put it into practice. Go with each person as they travel to their homes tonight. Give them safety on the roads and continue to be with us and guide us in our lives. We love you. In Jesus' name, amen. Good night, everyone.